This patient's a mother of 3. She's in her late 40s. Today we're going to be doing a high volume liposuction with fat transfer. Her main goal is to reduce the fullness of her tummy and also take out as much fat as possible from the back and create an hourglass effect. We're going to be transferring fat to her thighs to make her a little bit curvier. And her height is 5'7", her weight is 240. That puts us at a BMI of 37. This patient's 5'7", 240, BMI 37. We're going to do high volume lipo, which means that we're going to remove more than 5 liters of fat. We're also going to expand her thighs. She wants to prioritize the tummy, and she'll be coming back for a tummy tuck in the future. Alright, so we already performed step 1 and step 2. Step 1 was SST, step 2 was Vaser. Now we're in step 3, which is extraction. Everyone asks what kind of lipo you use, and it varies. Right now we're using a micro-air, which is PAL, Power Assisted Lipoplasty. That's what PAL stands for. Vaser is UAL, Ultrasound Assisted Lipoplasty. And if you look at cord and then you look at the canister, you know, we've been lipoing for about 15 minutes, and you can see how clean and pristine. This is always important. It's important in lipo-abdominoplasties, it's important in small girls, it's important in higher BMI patients. Having very clean aspirate with very little blood loss helps the recovery process. It helps make the procedure safer, especially if you're doing high volume. And overall, it's just good technique, always leads to better results. 360 lipo, high BMI case, or BMI is 37. Here's the upper back. We're going to lipo all this. The middle of the back. We're going to reduce these rolls as much as we can. Remember that even if I take out all the fat from the roll, there's still going to be a little bit of excess skin. So sometimes the roll completely goes away. Sometimes you get maybe like an 80% correction. It's variable and it's unpredictable. I'm going to enhance her outer thigh, create a little bit more curve. She doesn't want her butt to be that big or maxed out, but she does want a subtle enhancement. Close 360 lipo, high BMI. You can see regardless of the size and weight, we always get it right. Super tight hourglass, nice buttock. She looks amazing. All right, so here's our high BMI case. I'm pulling the skin because she has some loose skin from being a mom of 3 and a high BMI, but you can see she went from a pretty thick, boxy shape to a really nice hourglass. This is what it's essentially going to look like when she heals up. So this is a great result. High BMI. This patient was 240, 5'7", 240, BMI 37. Just a lovely result. All right, so the patient had a high BMI. We did high volume lipo. She's going to go to aftercare after. So yes, we can do high BMI cases. They have to be done right. Minimal bleeding. Patient needs to be kept warm, but they can be done safely. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.